colorectal cancer.
Colorectal
Cancer, commonly known as the colon cancer or bowel cancer, is a cancer for uncontrolled cell growth in the colon or rectum or in appendix. Genetic analyses show that essentially colon and rectal tumors are genetically the same cancer. Most colorectal cancer occurs due to a lifestyle and increasing age, with only a minority of cases associated with underlying genetic disorders. It typically starts in the lining in the bone on the left and trident, can grow into the muscle layer underneath, and they grow the bone wall.
Ved blod i avføring eller ved endrede avføringsmønstre skal man gå til lege. Legen kjenner på magen og undersøker med en finger i endetarmen. Ved mistanke om kreft skal endetarmen undersøkes. Dette gjøres med et rektoskop, som er et stivt rør med en lyskilde. Undersøkelsen kan
The histology of the tumor is usually reported from the analysis of tissues taken for a biopsy or surgery. A pathology report will usually contain a description of cell type and grade. The most common colorectal cancer cell type is adenocarcinoma, which accounts for 95% of cases. Other rare types include lymphoma and squamous cell carcinoma.
Look at a colon model, which I have here today. They look like little red bumps, and they can be anywhere in the colon. And this is what a polyp looks like. It can be small, flat, or it can look like a mushroom. And over time, over many years, it grows into a larger growth called a malignant growth, a tumor called a colon cancer.
So are there people that are typically at risk for colon cancer? Anything that increases your likelihood of having that?
First, age does. Okay. At age 50, we see a big jump in colon cancer. The average age is really 64. People who have family histories are higher risk of colon cancer. People who have not great lifestyles, poor diet, drink too much alcohol, smoke cigarettes, those are the major risk factors that increase your chance of getting colon cancer.
So those are important points to make. Risk factors for colon cancer includes your age. You know, everyone that's 50 and older, the average age, as Dr. Schechter pointed out, is 64. If you have a family history of colon cancer, also inflammatory bowel disease, ulcerative colitis and Crohn's disease. If you smoke, and your diet, you know, your diet's really important. Diets high in fat and red meat increase your risk. Once someone, you've identified someone, Dr. Schechter, with colon cancer or at risk for colon cancer, what are some of the diagnostic tests that you do to help figure out if that's what in fact they have?
Well, other than the history and blood tests and stool tests, the most important test is colonoscopy. And about 10 years ago, Congress passed a law saying that everybody's entitled to have a screening colonoscopy, which is actually paid for by insurance. And that's what's really revolutionized our ability to cure people, because we can catch colon cancer before it is a big tumor, before it spreads beyond the colon.
Wow. So can you say that one more time? So Congress passed a law that again?
Yeah, Congress passed a law. Our society, the American Gastroenterology Association, put a lot of pressure on Congress to say, you know what? We need a better test than a stool test for blood or sigmoidoscopy. We need a more thorough test that covers the whole colon.
Wow.
And the biggest object was that people couldn't afford it. But now insurance covers the cost of colonoscopy.
Wow. And so tell us more about this colonoscopy. What's involved? And you told us about who's at risk and what age we should be sort of, you know, learning about when we need a colonoscopy. What's involved with a colonoscopy? Right.
Well, colonoscopy's really changed. I've been doing colonoscopy for 32 years. So
Symptoms of colorectal cancer typically include rectal bleeding and anemia, which are sometimes associated with weight loss and change in lowered habit.
While some people may be at a higher risk, most cases of colorectal cancer happen without warning. That's why you need to follow the screening guidelines and be careful. You can learn more by watching our segment on screening and treatment.
Greater than 75 and 2 95% of colon cancer occur in people with little or no genetic risk. Other risk factors include older age, male gurney, high intake of fat, alcohol or red meat, obesity, smoking, and a lack of physical exercise. Approximately 10% of cases are linked to insufficient activity. The risk of alcohol appears to increase at greater than 1 drink per day. Screening is effective at decreasing the chance of dying from colorectal cancer and is recommended starting at the age of 50 and continue until a person is 75 years old. Localized ovarian cancer is usually diagnosed through sigmoidoscopy or colonoscopy.
Small amounts of blood are
As cancers grow, they may bleed. Small amounts of blood are not necessarily visible within the stool.
Cancer within the colon. Several trials have shown benefit from the use of this test as a screening tool. This test should be part of a regular exam. However, it will only detect cancers within the reach of the examining finger, cancers of the mid and lower rectum. Modern scopes have had several improvements. They are thinner and more flexible, with better fiber optics, allowing sharper images. In addition, the instruments allow the use of additional devices for a variety of functions, such as snares for polypectomies, forceps for biopsies, and devices. Flexible sigmoidoscopes are 60 centimeters long and are able to detect about 65% of all polyps. Upon the discovery of an adenoma, a colonoscopy is usually required to evaluate the proximal bowel. Case control studies have shown in terms of reduced colon cancer mortality and incidence. However, they only evaluate the distal end of the colon. A colonoscopy is the gold standard in terms of screening. A scope enters the rectum and is extended through the entire colon. This test almost all cancers and most premalignant polyps. It also allows for the removal of smaller growths. This test only has to be repeated every 5 to 10 years if no polyps are present. Virtual colonoscopy is a new technique that uses computed tomographic resonance images to produce computer-generated images of the colon. Patients still require bowel prep and have air insufflated into their colons. In experienced hands, this test is as good as a colonoscopy in detecting cancers and larger polyps.